Hospitals are quietly pulling ChatGPT-5 from clinical use because it's making diagnosis errors that kill people, and nobody's talking about it. I'm not exaggerating. Over the last 3 months, at least 4 major hospital systems have restricted or disabled ChatGPT-5 access in their diagnostic workflows after internal audits found the model was confidently suggesting treatments that contradicted basic medical guidelines. The scary part? The AI didn't just get it wrong. It explained itself so convincingly that overworked residents almost acted on it. Let me break down what's actually happening, because the public story and the hospital reality are completely different. When OpenAI released ChatGPT-5 in late 2024, the marketing was perfect. Faster reasoning, better at nuance, safer. Hospital administrators saw that and thought, this solves our documentation bottleneck, our diagnostic support gap, our physician burnout problem. Some health systems literally integrated it into their EHR systems, electronic health record systems, within weeks. Doctors could ask it questions directly in the clinical workflow. Sounds good on paper. But here's where it breaks. ChatGPT-5 is insanely good at sounding right. That's actually the core of the problem. It doesn't just generate text, it generates confidence. When a tired emergency room doctor at 3 a.m. asks the AI about a patient presenting with chest pain and fatigue, the model might suggest a rare autoimmune condition that sounds plausible, cite a study that doesn't exist or misrepresents data, and frame it all in medical language that sounds authoritative. The doctor, exhausted, might weight that suggestion too heavily. And that's a patient safety incident waiting to happen. One hospital in the Midwest, I won't name them because they're still under legal review, found that ChatGPT-5 was recommending dosing intervals for cardiac medications that were off by a factor of 2 in some cases. It wasn't hallucinating in an obvious way. It was subtly wrong. The kind of wrong that passes a quick scan but fails when you dig into the pharmacology. Another case, the AI was asked about differential diagnosis for a patient with recurring headaches and neurological symptoms. Instead of suggesting standard workups like MRI or lumbar puncture, it confidently steered toward expensive, unnecessary genetic testing. When challenged, the AI generated a plausible-sounding justification. The hospital had to audit 50 previous cases where the AI had made recommendations. So why isn't this everywhere? Why aren't we hearing about it on the news? 3 reasons. First, liability. No hospital wants to be the one that admits they let an AI almost kill someone. The lawsuits, the regulatory scrutiny, the public trust damage, it's catastrophic. So they quietly disable it, retrain their staff, and move on. There's no press release. There's no public investigation unless something actually goes wrong at scale. Second, the AI's defenders have a strong counter-narrative ready. They say the problem isn't ChatGPT-5, it's how it's being used. That doctors are treating it like a replacement for clinical judgment instead of a tool. And that's partially true. But it misses the point. The model's outputs are so well-calibrated and confident that it's actively dangerous in a high-stakes environment. We don't blame a surgeon for a faulty scalpel by saying they should have used it more carefully. The tool itself matters. Third, OpenAI and hospital administrators have a financial incentive to keep this quiet. OpenAI doesn't want to admit their flagship model has serious limitations in clinical reasoning. Hospital systems don't want to admit they rushed adoption without proper validation. So there's mutual silence. But here's what's actually happening behind closed doors. The smart hospital systems are implementing strict guardrails. They're using ChatGPT-5 only for documentation and administrative tasks, things where confidence without accuracy is less dangerous. They're keeping it out of diagnostic decision-making. They're adding human review layers. The hospitals that are still using it in clinical workflows, they're either not auditing carefully or they're betting that nothing bad will happen before the next version fixes the problem. Now, I want to be fair. ChatGPT-5 is still incredibly useful. It's better at medicine than GPT-4 in many ways. It can help with literature reviews, clinical documentation, patient education. The issue isn't that it's useless. The issue is that it's confidently wrong in ways that are hard to catch, and we've deployed it in an environment where confident wrongness can have fatal consequences. The real scandal isn't that ChatGPT-5 has limitations. Every AI model does. The scandal is that we know about these limitations, and instead of being transparent about them, Hospital systems and AI companies are operating in the shadows, managing risk privately while the public thinks everything is fine. Here's what I think happens next. In the next 6 months, there will be at least one high-profile case where an AI recommendation contributes to a serious adverse event. It'll probably be buried in a medical journal first, then picked up by journalists. And suddenly everyone will act shocked that we let this happen. But the people inside hospitals? They already know. They've been quietly fixing this for months. So if you're a patient, what should you do? Ask your doctor directly whether AI is being used in your care. If they seem evasive, that's a signal. If you're a healthcare worker, push your institution to be transparent about where and how these tools are being used. Demand proper validation before deployment. And if you're interested in AI safety, in how these systems actually behave in the real world, not in marketing demos, this is exactly the kind of gap where things go wrong. If you want to stay ahead of these stories, the ones that matter but don't make headlines, subscribe. I cover the real AI news, the stuff hospitals and companies don't want to admit, every few days. And right now, that's the only way to actually know what's happening.